The Wish Centre is a domestic abuse charity. We support victims, work with perpetrators and work with children and young people. We cover the Blackburn and Darwen area. Some of the wards in Blackburn and Darwen are amongst the 10% most deprived wards in the UK. And in addition to that, we have a very diverse ethnic population, which just adds to the complexity.
I feared for my life almost daily. He'd threaten with violence, say he'd get my children took off me. I wanted to leave from year 3 and I didn't leave till 7.5 years.
The Wish Centre are a real pillar within the community, and it's really important that we recognise that the great work that they've achieved has meant that Blackburn with Down's a better place to live and grow up.
Our emergency departments are massively busy. What the doctors have said to me is that we see the same people coming back again and again as the victims of violent crime, and we can patch them up, but what's going to stop them coming back in again?
In London, half of the people killed by knives and guns are aged 15 to 24. People in the age group are 6 times more likely than others in the population to be killed by a knife. We're very aware that once a young person becomes a victim of violence and exploitation, then they are very likely to be caught up in a vicious cycle of violence time and time again. Red Thread is a youth work charity. We specialise in partnering with the NHS to meet the needs of young people who are caught up in violence and exploitation. We work across 13 hospitals in London and the Midlands with young people aged 11 to 25.
We predominantly work in Greenwich and South East London. Greenwich has the second highest rate of teenage conception in London. Most people are just totally unaware that there are, these really young girls who have maybe left care, have no family. We are their only support. We developed Young Mums Aid, which supports some of the most disadvantaged women in London from the age of 14 to 21. 90% have a past history with Child Protection Services or CAMS. 2/3 have been in care themselves, and nearly 70% have experienced childhood abuse and domestic violence.
Anytime I've tried to go to support, they've all let me down. And then I started working with Mums Aid. We started with the housing first, and with the support worker. I finally had someone to help me, to reassure me I'm not going to be on the streets with my child.
Healthworks has a huge reach and provides a range of services around health, nutrition and exercise across Newcastle and the North East. Newcastle is one of the 20% most disadvantaged district authorities in England, with up to 1/4 of its children living in poverty. For over 25 years, Healthworks has led targeted work to tackle health inequalities for those living in the most socially disadvantaged parts of our region.
We need social and economic policy that will move in the direction of reducing inequalities, but we also need organisations like Healthworks that work with the local community to help them lead healthier lives.
Smoking, alcohol, obesity all impact on our surgical outcomes. We're very good at risk assessing, but not risk reducing. Without community-led organisations like Healthworks, I don't think we'd be able to target patients who really need support.
Having a third sector organisation located in the local community, close to where people live their lives, is of vital importance.